हेलो टू एवरीवन। आज हम जो एक टॉपिक लेके आए हैं आपके पास, उसका नाम है रिवाइज्ड कार्डियक रिस्क इंडेक्स। सो दिस इज द टूल विच इज यूज्ड फॉर द पेशेंट रिस्क estimation for the perioperative cardiac complications. It is a simple modification of the Goldsman cardiac risk index, and this risk index has been validated with various studies. So what is the main components and how it will be interpreted? We will discuss this thing in the further course. So there are six components in this revised cardiac risk index, and each component we will describe one by one. Each component can assigned 1 point, and after that we will get a final score on the basis of how many components present in the patient. तो पहला पेश कंपोनेंट है हाई रिस्क सर्जरी। हाई रिस्क सर्जरी इंक्लूड्स इंट्रापेरिटोनियल, इंट्राथोरेसिक और सुप्राइंग्वाइनल वैस्कुलर प्रोसीजर। These are considered as the high risk surgeries, which assigned the point 1 point. Next is the ischemic heart disease. So it can be by any diagnostic criteria, which can be history of angina considering secondary to MI, myocardial infarction, use of sublingual nitroglycerins, history of post positive exercise tests, significant pathological Q waves on ECG. Our patient has already gone under cardiac catheterization and diagnosis made by after the 2D echocardiogram. So all these by which diagnosis of ischemic heart disease com- finalized, then 1 point is assigned. And then next component, third component is the history of congestive heart failure. So history of congestive heart failure means patient may be giving the history of congestive heart failure, pulmonary edema, paroxysmal nocturnal dyspnea, bilateral race or S3 gallop rhythm in the patient, and or chest X-ray of the patient is showing the pulmonary vascular redistribution, signs of congestive heart failure. So if there is a history of the congestive heart failure, then 1 point is again given. Next component is the history of cerebrovascular disease, which means there is a history of transient ischemic attack, TIA, or stroke. Next is the diabetes mellitus, patient having the diabetes mellitus, which requires insulin for the control. This given a point 1. And next is the serum creatinine level. Serum creatinine level is a more than 2 milligram per deciliter, then it's signed up 1 point. So after that, we have the final score. Now we'll see there's a one word, it is called MACE. MACE. So this is major adverse cardiac events. So what is the major cardiac events? Major cardiac events could be myocardial infarction, pulmonary edema, ventricular fibrillation, primary cardiac arrest, or complete heart failure. This could be any of these can be considered as the major adverse cardiac events. So, what is the percentage? What is the risk of having these events in perioperative? So, it depends on the we what we get as a RCRI score. So revised cardiac risk index score. If we get 0 points, still there is a 0.4% chance of the miss. So in every surgery, if no history, no cardiac component is there, there is still 0.4% chance of the major cardiac events in the perioperative duration. If 1 point, then 1%, 2 point, then 2.4%, and if more than 3 in the RCRI score, then it's a 5.4% risk for the major cardiac events. So this is the risk stratification score, revised cardiac risk index. It also known as Lee's revised cardiac risk index. So I hope this will be beneficial for you. We will meet in some another video. Thank you. उम्मीद है कि ये इन्फॉर्मेटिव रहा होगा वीडियो आपके लिए। छोटा सा वीडियो था। हम अभी और वीडियोस आएंगे आपके लिए। स्टे ट्यून्ड। और भी सारे इन्फॉर्मेटिव वीडियोस अभी और बनते रहेंगे। अ, बहुत सारे इवेंट्स के से रिलेटेड, टॉपिक्स से रिलेटेड नए-नए वीडियोस आएँगे, आपको नॉलेज मिलेगा। आई होप इट विल बी बेनिफिशियल फॉर यू। थैंक यू।